Before beginning any tibia preparation, ensure that as much of the medial and lateral meniscus is removed as possible, which will help with exposure and bone removal. With the knee inflection, use the tibial sizing template to visualize base plate rotation and medial lateral placement according to the following steps. Align the sizing template in the optimal position for midline medial lateral coverage. Ensure that the anterior medial and anterior lateral portions of the sizing template do not have significant underhang or overhang. Ensure the sizing template has fully captured the ACL. Do not set the tibia rotation based off of the placement of the femur, orientation of the ACL fibers, or the tibia tubercle, as these landmarks could lead to poor tibia coverage. Note: the tibia sizing template and corresponding markings should be as far lateral as possible, without sacrificing the ACL. There is a tendency to medialize this alignment, and that needs to be avoided to prevent medial implant overhang. Insert the ankle clamp into the distal end of the alignment tube and thread the locking pin into the ankle clamp. After the ankle clamp is moved into the proper position, lock into place with the gold knob. Choose the correct 3-degree left or right datum block. Place the appropriate left or right 3-degree tibial datum block on the non-spike fixation rod. Tighten the central screw to lock the block into position. Introduce the rod into the extramedullary assembly and adjust and lock the locking screw in the assembly. Place the arms of the extramedullary alignment clamp around the ankle and adjust the distal medial lateral slide directly over the middle of the tibio-talar joint, which is also approximated by the second ray of the foot proximal to the malleoli. Mate the datum block to the anterior tibia by making the groove roughly in line with the medial marking from the tibia sizing template to ensure the block is not too lateral. Then align the top of the datum block with the provisional depth mark from the distal femoral gauge and place a 65 mm headed speed pin through the upper half of the datum block's provisional slot to stabilize. Do not fully seat pin. Direct the headed speed pin into the upper half of the provisional slot, as the distal femoral gauge marking tends to overestimate the tibial resection if the knee is hyperextended in the distal cut step. Next, set the slope and varus valgus of the extramedullary alignment rod neutral to the tibial mechanical axis and lock using the EM tower assembly. Finally, set depth using the depth stylus to reference the center of the medial tibia plateau. In the case of extreme medial wear, reference the lateral tibia or adjust the stylus for appropriate compensation. Fix the datum block by pinning through the 0 mm set of holes with 65 mm non-rim speed pins. Tighten the headed speed pin in the slot for additional stabilization. Inflection. Assemble the orientation stylus by engaging the foot into the tibia datum block and ensure the arms line up with the provisional eminence marks. Lock the orientation stylus by pushing up on the gold locking cam. Verify that the cruciates are inside the resection planes, indicated by the outer surface of the orientation stylus arms. Before locking the orientation stylus into place, check with an angel wing to ensure the cutting plane lines up with the previous tibia markings. After the gold lever is used to lock the orientation stylus into place, drive an 1/8-inch drill or 3.2 by 110 mm pin into each of the medial and lateral undercut protection holes. Be careful not to protrude through the posterior cortical bone. Use a 1.5 mm thick reciprocating saw blade to make the medial and lateral sagittal resections first. Use a narrow oscillating saw blade to finish the medial resection. Remove the drills, pins, and orientation stylus. When removing the lateral drill pin, mark the hole, as it will be needed during the lateral tibial cut step. Insert the femoral trial onto the prepared femoral bone using the femoral trial impactor. Select the best size medial baseplate trial. Find the medial insert trial thickness, which results in 1 to 2 mm laxity in extension and flexion. Red insert trials represent recut options for balance management. Each red insert trial corresponds to an instrumented recut option, more posterior slope, and/or more depth. If the thinnest 8 mm neutral insert option does not fit into the joint in extension and flexion, a red 6 mm gap stick can be used, which signifies a 2 mm recut for depth is required. If the flexion space is right relative to the extension space, downsloped insert trials are available to simulate a 2-degree recut of slope. In this scenario, A 5-degree cutting block can replace the 3-degree primary datum block. Be sure to prepare for the lateral resection by re-drilling the lateral eminence hole through the orientation stylus after it is attached to the datum block setup for the recut. Blue insert trials represent implant options for laxity and flexion relative to extension, less posterior slope. Each blue insert trial corresponds to an insert implant option. Locate the lateral eminence pinhole. Press the floating pin of the lateral saw capture block into the hole while slotting the posterior tip of the saw capture behind the patellar tendon. Attach the lateral saw capture block to the datum block. Adjust the lateral saw capture for optimal fit against the lateral anterior tibia and under the patellar ligament, and lock using the datum block. Resect the lateral tibia using a narrow oscillating saw blade.